Hi, Debbie Abels with Simply Put segment. We're back at Infinity Laser with Tina Simpson and some new girls, and we'll introduce them in a minute. But Tina, what all's going on in Infinity right now this week? You've got a lot of fun, I know. You're always crazy.
Well, Kate actually comes back from vacation, so she'll be back so she can do the facials.
Perfect.
And, you know, we're always doing hair removal, skin rejuvenation.
Right.
We do spray tanning now. That's going really good. So if you're going somewhere and you want to have that instant tan, just stop by. We can have you up and ready to go in 5 minutes. And the tanners look really good. We can do anywhere from a light tan to if you want a dark cocoa tan, we can do that too.
Perfect. And then too, I know that the massages and all, we're all out there working in the yard and doing things that we normally don't do. And Lydia does great.
It's fabulous. Yes, if you want a good massage, she can do the deep tissue massage, the pregnancy massage. I just like the relaxing massage pan for me.
Yeah, that's
so
perfect.
yeah, she is fabulous massage, fabulous.
Well, they've got some specials. We'll be talking about that a little later in the program. But right now, I want to introduce you to Chantel Unseld, and our guinea pig is Michelle Bowling, who you will see also in the face. We had the facials the last time, and she volunteered immediately after having such a great facial. In fact, I think you booked another one, didn't you?
I did, and it was wonderful.
All right, and so today we're going to be doing some injectables, am I right?
Yes, ma'am.
Chantel, tell us a little bit about you, how long you've been here, what your background is, and why we should trust you with the needle.
Oh, the last question. What a crazy question. My name is Chantel Unseld. I've been injecting here with Tina for approximately a year. I'm actually a nurse practitioner at an OBGYN office during the day, so I've been practicing at that for about 6 years and came across Tina and a little opportunity, so we started doing some cosmetics, and it's really went well.
Well,
it's nice to kind of have a different aspect with women on a different angle and a different side, and just to kind of appreciate what they feel about beauty and how we can improve that. And there's been a lot of good stories as far as, you know, just what people look in the mirror and how they feel about themselves, and how we've been able to really turn that around to where they can look back in the mirror again and they're happy with who they see, or they're a little older and they want to look a little younger, or go into a high school reunion, or just want to stay youthful.
That's
so it's nice that there are little subtle things that people can come in and do that are 15 minutes, 20 minutes, sometimes an hour, but they can leave with minimally invasive procedure and really have a big impact to what they look like, and no one really know. They just know that they subtly look different and they've improved it with their look.
well, I have seen a difference. I know Michelle had said she had had this done one other time or something similar. And really, I ran into her about, maybe 10 days later, and I said, God, you're looking really fresh and, and glowy and everything. What'd you do? And then that's when she fessed up, but I would have never known it. But I know that earlier, while we were kind of going over all the details and everything before we were on camera, Chantel was really talking about some of the muscle relaxation and what will take over and all, and I want you to talk about that as you go through the whole procedure. But we're going to let you do your thing, and you just talk to her just like you would if we weren't here, and I think we'll get a real strong gist.
Okay.
And I'll ask you questions if there's something that I think that we need to hit on.
Okay.
But I really think it's great to have a nursing background and then have been here at least a year, haven't you?
I have been. I have
Perfect.
been. And before I did my training, I didn't realize exactly what all went into the face and how many muscles were there. And it's just very important to know what muscle groups do things and what makes your wrinkles. And then you can really work on tweaking that perfect patient to get them that maximum result that they want.
All right. Well, let's let you go ahead and get started, and then I'll kind of ask you some things about maybe, in between, how long it lasts, how many times you might have to do it, and that type of thing. But kind of talk us through what you actually are doing.
We have chosen the forehead for Michelle.
Okay.
She doesn't like the wrinkles. Lift your forehead.
Oh, yeah.
Yeah, she doesn't like these wrinkles, and unfortunately that's just her facial expression, so we're going to allow those to minimize so she can still have that youthful appearance and nobody see those lines. So the first thing I do is just numb the area, and we kind of analyze, and we've kind of done that beforehand, just what problem area she looks in the mirror and she sees, what she wants to change. She says she's had it before, and she knows that that's really minimized those wrinkles and really opened up her eyes. Everybody wants to kind of have an open, fresh look without that very stigma of a painted look where you don't have the movement. So definitely Botox is a very natural, subtle way to reduce those fine lines and wrinkles. Okay, now lift your forehead for me. All right. right.
Okay, so you're just going to mark where they
We're
really
going to
are.
mark where those lines are and where we want to hit those.
Boy, Tina, I don't know about you, but they'd be marking all over me.
You and me both.
We'd look like a crossword puzzle when it was all said and done. But then I think I've got some age on Michelle, so that's
Not
really,
much.
Oh, I bet. I'm a good 10 years older, I know that.
We won't tell. Okay.
Well, how does it feel so far?
You doing okay? And we just use a very fine needle, so I've already drawn up kind of what I wanted to do with this. It's just a little insulin needle. Most people really can't even tell that it's been injected. It's just a little kind of a sizzle type of a feel with it, and then it only lasts for just yeah, very teeny tiny. So I mean, it's something that you could do on your lunch break and go back to work.
Perfect.
Yeah. So.
Kind of talk us through it.
Okay, so this is actually the frontalis muscle here, so it's a big muscle. So we're going just straight into the muscle. We're going to paralyze that muscle, and then what Botox does, it stops at that neurotransmitter to prevent that movement of that muscle. Okay. So when you prevent a movement of the muscle, then you have other muscles in the face that will counteract and pick up for that movement. So you'll still be able to close your eyes, open your eyes. You'll still be able to make that little bit of an expression. And Botox lasts for approximately 4 months. It's FDA approved for 4 months.
Wow.
And then slowly the movement will just come back. And then it's up to her whether or not she wants to inject again or she wants to wait. Most people feel like, is this going to be worse after that 4 months? Is that wrinkle just going to come straight back? And the answer is really no. It just subtly comes. You subtly notice the movement.
Okay.
And then really it's up to you, you know, how that looks. If it's 5 months, 6 months go down and you're liking the way you look, then, you know, you wait until you're ready to do it again.
Okay.
So. All right, so we'll get one little...
So you just kind of go right in those little dots that you made.
You got it.
Well, I got to tell you, she's not even flinching.
Yeah, she's doing perfect.
And Michelle can be a flincher, I bet. Tina, I know you've had it done.
Yes, I've had it done between my eyes, and my youngest daughter will look at me and she'll say, "Mom, I know you're trying to make the mean look, but you don't look mean." Because I had the Levens, you know how not everybody, but unfortunately, I had the lines between my eyes. And it was deep, and it has done a great job.
Well, a great job. I've seen a big difference in you, because I remember you saying that. And Michelle, too, with it. It really does. Well, shoot.
It's very subtle the way it comes on, and then very subtle the way your wrinkles kind of come back. So it's really not noticeable to people, I don't think. Fresh is a good word. It freshens your look, I think.
And you didn't notice a big change right off the bat.
I did not. In fact, it takes several days before you actually notice it. In fact, you might think it's not working, but then...
Patience.
Yeah, patience. And then it does. And I was very happy the first time, and I'm sure I'll be happy this time. So.
Well, that's interesting. And you do, it's so much... a vial or whatever, but you've got a special, you said, going on.
It is. We also do Juvederm, which is a derma filler.
Okay.
So our Botox is $10 a unit, and that's about across the board. And depending on how many units you use, and we always, you know, analyze how many we need beforehand. But our Juvederm special, which is obviously kind of counter or goes together with Botox. And we use Juvederm for places, the parentheses, the marionettes, those lines that, those frown lines that people, those smile lines that people look at, and they don't like how those have become deeply grooved there. So what filler does is a hyaluronic acid, and it builds, it's almost a collagen stimulator, and so we insert this derma filler right in the dermal layer of the skin through an injection, a needle about that size.
Okay.
And you use, depending on 1 syringe, 2 syringes, or 3 syringes, depending on your need. And then once we insert that, you notice then an immediate result. You notice how it looks immediately. And over time, collagen builds underneath of there, and you reduce that fine line and wrinkle. And filler lasts for approximately a year. Juvederm is approved for a year. And we now have a new little app on my iPad that I can take a picture of you and show you exactly what your filler is going to look like with 1 syringe, 2 syringes, or 3
I
syringes.
think that's great.
Oh, well, I like that.
Yeah.
That's great that
That's
they
a
can
good
see.
idea.
Yeah, so depending on your budget, if you want to do 1 and you like that subtleness that it's improved,
Yeah.
and you want to do 2 later, you can always add. And generally, once you do 2 at first, the next year you do 1 just to kind of touch up.
Perfect.
Yeah.
Well, I know you've got a special too.
Yes,
today.
our special now is buy 2 syringes for $800 and you get a kit of Latisse for free.
Tell people what Latisse is. I know, but a lot of them may not.
Yes, Latisse is, it's for eyelashes to help lengthen the eyelashes and make them fuller. It's the only one that's FDA approved that's really worked. And Tina can kind of vouch, she's used a couple other
Yes.
products and
It really doesn't work. At first I thought, oh, it's not working that good. But it's because Tina's not doing it regularly. And Chantel did. Chantel was like, Chantel, your eyelashes look so good.
and I've got to tell you, I didn't know that you were doing anything Latisse, and I was like, gosh, I'd like to have eyelashes like that.
yeah, because I did not normally have eyelashes like this, so I thought, well, if I'm going to promote this, I need to see what my product looks like.
That's true.
It's easy to apply. It just goes on every night on a clean eye. Once you get to the result that you like, then you back down to 1, 2, 3 days a week, and then just maintenance as you need to. So now I just use it one time a week, or when I think about it.
Well, this is really a $300 value, am I not right?
Absolutely. Filler is normally $550 for 1 syringe. When you get 2, we're going to give you that significant discount. We're going to throw in a thing of Latisse, which is normally $125
That's huge.
for a kit.
Yeah,
And the
it's
kit
great.
lasts about 3 months, so it's not like you're buying it just for that. You're getting, I've honestly had mine since last year, and I'm still using it.
Okay.
Yeah, so you should, depending on everybody's level, most people notice a result within that first month to 6 weeks. They really start noticing improvement, and then it's just maintenance after that.
Well, I tell you what, you didn't squirm or anything.
And I hate shots. It's just not. There was one little spot, and it's the same spot every time that I can
Feel it.
that I
Just
can
a
feel
little.
it just a little, but not even enough to make me cringe. So yeah, it's not painful at all.
And you said
So
you hate
worth
shots.
it.
So worth it.
Yeah, I do not like shots, and I always keep my eyes closed. So.
Yeah, it helps when you don't see the needle
I don't
come
wanna
into
see
your
it
head.
coming. It's just not painful at all.
God.
I
Yeah.
wouldn't do it.
Well,
I wouldn't have done it after the first time if it were painful
perfect.
Yeah.
or uncomfortable at all. I just wouldn't have done it. It's not worth it.
Well, we're going to be promoting this in issue 15 on stands this next Friday. Well, this Friday coming up. This is on a Tuesday when we're while you all are watching this. So this Friday, the special will be in the paper for the next 2 weeks. And Chantel, you'll call here and try to get into her schedule, because I'm sure after this you're gonna get really
Absolutely.
busy.
We have 10. We have about 10 slots available for this. So once we fill up, we're done.
Perfect, perfect. We would love to have you give them a call. And Tina, tell about Infinity Laser, where it's located, and also the telephone number.
Yes, my number is 502-350-4556. I'm at 128 Keystone Avenue. I'm at the red light right by Keystone Liquor or by Keystone Cinemas. So just think Keystone and we're right there.
And then they'll make the reservation for you, appointment.
Yeah, you can
with
call
her.
me. You can call me. You don't have to call Chantel. Call here at the office and I will schedule an appointment with
That's
her.
perfect, that's perfect. You gonna come back?
Absolutely.
You said that
Yeah, I'm
last
going to
time and
talk
went ahead
to
and booked.
Chantel when we get off camera.
Well, surely since you've been, now our movies star twice, there should be some sort of
there's that.
incentive there. For sure. Now, what else have we not done to Michelle we could?
Feel free to Juvederm me.
I was thinking that would be good for me. But it'd be hard for me to talk on camera and get it done at the same time. That's the thing. Well, Chantel, we're thrilled to death. And if we can turn out looking like her, I'm totally all about it.
Thank you. Thank you.
Thank y'all so much for watching.
Come see us.
Do, yes. And this is our third or fourth? Our fourth?
We did the hair removal. We did the facials.
Facials.
We did
Spray tan.
and now
Now this one.
Botox. Next we will do the massage
Perfect.
with Lydia.
Perfect. We'll
Yes.
be back. We're going to show every service that they've got, and you all, by now, I've almost personally gotten to know every one of them. But the first time on camera for Chantel, we like her.
You did a great
She did
job.
do a good job. And Michelle's just won the family now, too. So thank you all for watching. We appreciate it. This is Simply Put segment. And be sure to pick up issue 15 on Stands on Friday, which will have all their information in there. And we appreciate you watching.